Hey everybody, it's Manny again. Coming to you today from my house in Long Island, and I wanted to just take a couple of minutes to finish up my heart disease risk factor series for February, which is the American Heart Association's Heart Disease Awareness Month and the Go Red for Women campaign. And we basically covered just about everything this month with respect to heart disease risk factors, but I'm on call on a Saturday, and I wanted to talk about cholesterol and family history because they kind of go together in a lot of ways, and that's really kind of the one big topic that we haven't discussed yet. So, I was working on a patient this week who had a heart attack, and I get this a lot where he says, "Why did this happen to me?" And basically what he was implying was that, look, I'm a pretty healthy guy. I eat healthy, I exercise, I've been active, and I've never had problems. And why did this happen to me? And well, there's not really any accounting for family history and for the cholesterol that we have. I think we all know, or at least I know, a lot of people who have had, frankly, terrible eating habits, but their cholesterol numbers look really good, and other people who eat very well and eat very healthy, and their cholesterols are totally out of control. And I think that probably gets to the way that our bodies metabolize cholesterol, and there's not much that you can do about the fact that there's just certain genetics at play that, we don't really know everything about how cholesterol is metabolized, but it's definitely, there are genetic components with respect to the way that it's deposited in the walls of arteries and with respect to how it hardens the walls of the arteries. So what are the different types of cholesterol? I think a lot of us have heard the terms LDL and HDL before. LDL is low density lipoprotein, which is the so-called bad cholesterol. HDL is the high density lipoprotein, which is the so-called good cholesterol. And it's really kind of a moving target with respect to what your numbers should be. I think good cholesterol, the higher the better, of course, but the numbers you need to know, and this gets back to, again, going to your doctor once in a while and just getting these numbers and knowing what your numbers are. For men, an HDL less than 40, and for women, an HDL less than 50 are considered risk factors for heart disease. So women tend to naturally have a little bit higher level of good cholesterol. So, the higher the better, but those are important numbers to know. For LDL, it's a little bit of a moving target. The recommendation from the societies have changed over the last couple of years. So I'm not really going to talk too much about specific levels of bad cholesterol. Certainly the lower the better. But a lot of that also has to do with if you've had any history of heart disease or diabetes or strokes in the past, then those numbers and those targets that we shoot for are much lower. What is a family history? A family history of heart disease. So, we talk about, for example, when I ask patients, do you have a family history of heart disease? What I'm really asking is, do any of your parents or any of your brothers and sisters, have any of them had heart disease or heart attacks at a younger age? And generally, we're talking about people in their 50s to maybe early 60s. There's specific numbers, but I won't bog you down with the specifics. But basically, if you had parents who had heart disease at a younger age, like in their 30s or 40s or early 50s, that would be a risk factor for heart disease for you. And that's something that's important to know because it really impacts how aggressively we try to modify your other risk factors. How aggressively do we treat cholesterol, blood pressure, and so forth. So that's kind of what family history is, and it's important to know that when people have a family history of heart disease, that probably is one of the biggest predictors of your risk for having heart disease. So I'll finish up the video with a couple of ways that we can impact cholesterol and impact particularly good cholesterol. There's a lot of great medications that will lower bad cholesterol, and I don't want to talk too much about statin medications, which are great for what they're indicated for, but I think that's all kind of understood, and you can get a lot of that from your doctor. But what I really hoped for in this series of videos is to get away from the medical stuff, and how can we impact levels of cholesterol with healthy eating, with exercise. And I think I want to spend a minute just commenting on good cholesterol, because there's a lot of great medications, like I said, that will lower levels of bad cholesterol, but really nothing that's great for raising good cholesterol. The statin medications that are out there, Lipitor and those kinds of drugs, don't do a very good job of raising levels of good cholesterol. Really, there's only one or two medications out there that will raise good cholesterol, and they can be tough to really tolerate. They have a lot of kind of side effects that are undesirable. But I think the single best thing that you can do to raise your level of good cholesterol is regular aerobic activity. That's been proven over and over again. Regular exercise. Again, we talked the other night about brisk walking, about cardiovascular endurance. Any of those kinds of regular aerobic activities 3 to 4 days a week for a half hour at a time is definitely proven. This is scientifically proven to raise levels of good cholesterol significantly. You can raise your levels of good cholesterol as much as 30 or 40%. I know this because I have achieved that myself. Some of you know me to have lost a lot of weight over the last couple of years and really gotten into physical fitness and regular exercise, and I can tell you that my numbers of good cholesterol went up 40% just from the weight loss and the regular exercise. It's nothing that I could have achieved with medications alone. So it's definitely doable, and it's definitely important. My HDL went from 37, which is a risk factor for heart disease, to 52, which is not a risk factor for heart disease, and I'm very happy about that, obviously. But it's just another benefit of regular aerobic activity. And it's something that as physicians we generally don't spend enough time about talking about in the office, because there's just not a lot of it takes time to really have that conversation right. And you know, a lot of times people don't really know enough about regular exercise and the benefits to really have that discussion in detail. But exercise is by far and away the single best thing you can do to raise your level of HDL, which is the good cholesterol. And we all know in the scientific community, it's been proven that HDL, a high level of HDL, is probably the best component of cholesterol to reduce your risk of heart disease. Or another way of saying it is that low levels of HDL, low levels of the good cholesterol, is probably a bigger risk factor for heart attacks and heart disease than high levels of bad cholesterol. So I'll wrap it up there. I encourage you to go to your doctor. Basically, every adult, any adult should have their cholesterol checked at some point. And even if your cholesterol numbers are great and you're young and you're otherwise a healthy person, you should probably get your cholesterol checked at least once every 2 years. And then talk to your physician about your other heart disease risk factors and if your cholesterol numbers are at a desirable range. So I'm going to finish it there. This is the end of my heart disease risk factors video series for February, which is the AHA's Go Red for Women month. I hope that you guys got something out of this. Please let me know, one, where you're watching from, and two, if you have anything that you would like me to talk about moving forward. I've got some ideas for other things to talk about in the coming weeks. But again, I hope you got something out of this. I hope you guys will share this with people who might benefit. I thank you guys for liking my page, and I hope that you all will like my page if you got something out of this. So have a great day, everybody. Have a great weekend, and I'll talk to you again soon. Bye-bye.